Welcome everyone. Thank you for joining us in today's panel webinar, COVID-19, Challenges of Returning to Work or Staying at Work During a Pandemic. My name is Yusra Benjeloun, Administrative Coordinator and Project Manager with the Work Wellness Institute, and I'll be moderating today's webinar. We would like to thank our academic team and our 9 founding partner organizations in the Harnessing Talent project. Harnessing Talent, Alliance for Recruiting and Retaining Canadians with Disabilities and Mental Health Challenges, is a 3-year project funded by Employment and Social Development Canada. This webinar is made possible through the support of ESDC, as well as donations and memberships to WWI. We thank our advisory committee and speakers who contribute to this webinar series. We're very excited to welcome our panelists, Dr. William Shaw, Dr. Vicky Chrisman, and Dr. Doug Gross. Dr. William Shaw is an associate professor and chief of the Division of Occupational and Environmental Medicine in the Department of Medicine at the University of Connecticut School of Medicine in Farmington, USA. He also has adjunct scientist appointments at the Institute for Work and Health in Toronto, Ontario, and the Research Institute for Enhancing Prevention of Injury and Disability at Work at Lakehead University in Thunder Bay, Ontario. Dr. Shaw has more than 20 years of research experience in the field of occupational health and safety. His training background is in engineering and clinical psychology, and his primary research focus has been workplace disability and return to work, especially with respect to psychological and organizational factors affecting outcomes for workers with acute musculoskeletal injuries or chronic health conditions. His research has contributed to current knowledge of effective employer policies, supervisor training, job modification, disability management, psychosocial screening, and return to work coordination. Dr. Vicky Chrisman is an associate professor in the Department of Health Sciences at Lakehead University and the inaugural director for a new research institute at Lakehead University, EPID at Work, enhancing the prevention of injury and disability at work. She also holds appointments in the Northern Ontario School of Medicine and the Institute for Work and Health in Toronto. Dr. Chrisman is currently the Lakehead University delegate for CIHR and sits on the University Delegates Executive Committee. She holds a doctoral degree in epidemiology from the University of Toronto and completed the CIHR Work Disability Prevention Strategic Training Program as a postdoctoral fellow at the University Health Network in Toronto. In 2014, Dr. Chrisman was awarded a prestigious CIHR New Investigator Award for her program of research on preventing work disability through accommodation. She's currently leading projects to test the effectiveness of a supervisor training program to prevent prolonged work disability, to identify factors associated with Indigenous work, health and safety, and to determine factors associated with supervisors' support for providing work accommodations for workers with mental health disorders. Dr. Gross is Director of the Rehabilitation Research Center, RRC, and a Senior Associate Editor with the Journal of Occupational Rehabilitation. Dr. Gross studies the prevention of disability in people with physical and mental health disorders. This includes investigating the effectiveness of clinical and public health interventions, the validity of clinical decision support and other assessment tools, as well as factors associated with disability. He has given numerous national and international presentations and published over 100 peer-reviewed articles. Thank you so much, all of you, for joining us today in this very compelling webinar. I'll hand you the floor without further ado.
Thank you, Yusra, and thank you for all of those who are joining our webinar today. The focus of our presentation will be on understanding, measuring, and trying to reduce the impacts of COVID-19 pandemic that we're all struggling through right now. And we'll be talking about mostly from a workplace context. And like many presentations that you've probably seen on COVID-19, we have a blend of ideas and topics to present to you. I'll be starting off with some general comments, and then our other 2 presenters will have some more specific data from some of the research and clinical work they're doing. And of course, we're grateful to the Work Wellness Institute for allowing us to present to you today. Next slide, please. And if there's one thing that is common across all three presenters today is that we were some of the authors on an editorial that we wrote for the Journal of Occupational Rehabilitation last summer. And the precipitating event for this editorial was that we were all noticing that many of the same factors that we were studying in our return to work and stay at work research were sort of emerging as potential important issues around COVID, issues around psychosocial factors in the workplace, work organization issues, supervisory relationships, concerns about workplace exposures, and issues around job flexibility and accommodation. So we wanted to kind of talk about that in an editorial, so I invite you to look this up if you're interested in reading more about that. Next slide, please. It may seem almost trite to talk about how serious the COVID-19 pandemic has been for us over the last year. And we're probably all trying very hard to not think about it as much as possible, but I think it is informative to just take a moment to think about how this event has had such a large impact in the workplace. So it's produced an entirely new form of workplace viral exposure that we haven't really thought about much unless you happen to be in a healthcare setting. It's had a really profound impact on the boundaries between family, work, and health, especially if you're working from home and trying to watch small children at the same time, and it's really created a much blurrier lines between work and home life. It's altered many of our well-established rules that we have known for a very long time in terms of workplace engagement and practices. It made us change some of our business structures and alignment and communication, the way we do things in the workplace. There's been rapidly changing information about COVID-19 over the past year. So this has created a huge complication for workers and for employers in trying to roll with the punches and react to new information as it's rolled out. And there's been a lot of uncertainty about the future. It's just in the past week or two that we've really seen evidence that a vaccine is coming soon. So we're beginning to see a light at the end of the tunnel, but it's been hard to kind of respond to an ever-changing and uncertain sort of situation. So in many ways, this has really been the perfect storm in terms of factors that are likely to affect worker well-being. And I think it's the overall theme of our presentation that we really need to be turning more attention to the mental health and well-being needs of workers in the months that lie ahead. Next slide, please. And in addition to all the challenges that we face with our work, COVID-19 has also influenced a whole lot of things at home too. It's increased, we have problems around childcare, especially for young workers. We have to worry about the health of our family members and potentially bringing viral transmission between work and home. There's a social disconnectedness that we all sort of share, if you're out of the workplace entirely. A lot of changing family dynamics and habits, a lot of postponing of the kinds of things that we look forward to, and vacations and family get-togethers, lots of canceling of the community events and things that give our life structure, and for some even having to experience the grief and loss of loved ones during this time. So it's really been both occupational issues around COVID-19, but also non-occupational issues as well. So it's really hit us from both sides. Next slide, please. So I think where we all are right now is trying to figure out what do we do next. And I think we all have this same sort of conundrum, whether we're talking about our own personal lives or our workplace organizations, or if you're a healthcare provider, thinking about how you deal with patients. But I think we're all trying to figure out, do we just kind of keep soldiering on the way as best we can and as normally as possible? Do we sort of take a Band-Aid approach where we try to find little problems that we can fix along the way? Or is this sort of a transformative moment? And I think I'm beginning to see more in the news and more scientific articles about this. So have we learned some things about the workplace and about ourselves that may actually have really long-standing changes in the way we do things for a very long time, even after COVID-19 is gone. Next slide, please. So there's a lot of information available now. There have been a number of both workplace surveys, employer surveys. There's also population surveys now beginning to be published about what are the mental health impacts of COVID-19. And these are data from a Unum survey of workers that was conducted last summer that shows that more workers had mental health concerns, a lot more were feeling lonely, some were feeling over Zoomified and with a little too much technology. People were reported poor eating habits and diet and physical activity, and of course difficulty with financial problems as well that we all know about. So these kinds of issues are really, you can see more and more reports of this recently, and actually the news in terms of mental health seems to be getting worse. Next slide, please. So just to continue on this point, so these are some data from the CDC that reported that 40% of US adults are reported struggling with mental health or substance abuse. In recent other surveys, it's also been the case that about somewhere between 40 to 60% of workers are reporting worries, stress, anxiety about the future, and in a much more significant way than we would normally see. Next slide, please. And I think what's especially frightening is the data on these kinds of really important mental health endpoints like suicide and overdose rates. These are data that were published in a Washington Post article last summer that really reported a 40% increase in overdose rates compared with a year prior to that. And so you can see that even in those first few months of the COVID pandemic, there was a pretty remarkable change in in overdose rates, and I think the more evidence comes out on this, the worse it looks. So we definitely are seeing very concrete evidence that the mental health of our population and of our workers is suffering. Next slide, please. So exactly how COVID-19 is affecting your life and your work depends very much on which one of these categories you fall into. So if you're an essential worker, you might have mostly risks about infection and whether or not you're safe and have adequate PPE in the workplace. There was a news item published in the Institute for Work and Health newsletter this week that reported that workers who were at work but were afraid of the infection risk they were facing actually had poorer mental health than those workers who had lost their jobs altogether. So I think that's really compelling about just how frightening it can be for workers who feel like they're being exposed in the workplace. Other workers are trying to find ways to return to work gradually. Some are continuing to work from home, and others are furloughed. So everyone pay attention here because we're going to try to do a poll question now. And the question that we will have is on the next slide. And our question for you is, in your employment setting, what % of individuals are currently working from home? So you should be able to choose, make a selection here. And we'll give you about 30 seconds to do that. Okay, and it looks like the winner is 70%, 75% or higher, although we have about 13% of people who are listening are actually working at work. So we have a spread, but you can just see from these data just how much we're working from home now, especially if you're a knowledge worker. It's much more difficult if you're in manufacturing or healthcare or other areas that represent essential working groups. So thank you for that. So we'll move on to the next slide. I think one thing that's worth noting, maybe it's a silver lining, is that a lot of people have done pretty well working from home, even despite all the challenges that they faced in doing that. And so a couple of surveys have come out. I think the news has gotten a little more negative recently in terms of how employers maintain communication with their workforce, but originally in the first few months after the pandemic, people did surprisingly well. So the initial estimates of productivity change was not what was expected, and people actually were able to perform pretty well at home. In fact, some people even said, well, it took away a lot of the stressors that I face when I actually am at the workplace. So some people actually like it. And this will be, an interesting challenge for us when we go back to the workplace, because some people, and I think this is probably truest among youngest workers, is that they're perfectly happy to work from home and never really wanted to be bothered to go into a workplace anyway. So this could really change the way we do work for a very long time. It also resolves issues around commuting time. If you have people you don't get along with, particularly at the workplace, this alleviates a lot of stress for you in that regard too. So, slowly over time, people are getting more and more accustomed to this way of life, and maybe more and more difficult to change once the COVID-19 pandemic is beyond beyond us. So, next slide, please. We know a lot from research about things in the workplace that lead to stress. And these are just a list of what I think are the predominant job stress models. Pretty much every one of these would explain that the current situation would cause a great deal of stress among workers. For example, the transactional model would really say that if the way people appraise challenges in the workplace has a lot to do with whether or not it causes stress, and that trying to interpret and react to a very fast changing situation, it creates a lot of stress for a lot of people. The effort reward balance model is one that might also point out the challenges that workers face who are still at work and are essential workers, but having to deal with this added burden and stress of trying to work safely. Next slide, please. And we also know that job stress causes long-term health consequences. It also causes long-term organizational consequences. And so there are many types of job stress that we're seeing right now in response to the pandemic. Some of those are difficulties in understanding how you fit into a newly defined work organization. There's the usual kinds of things around work demands and competing demands with family. It may be more difficult to understand what your capacity is for being promoted, or for a management career in an organization that's ever changing. And we know that a lot of those things lead to negative outcomes. So I think most of our attention early on in the pandemic was focused on how to protect workers from a viral transmission standpoint. I think now we're beginning to turn more towards how do we look out for worker well-being. Next slide, please. There has been a lot of evidence. There have been a lot of efforts by government agencies, by all sorts of researchers and university institutions about things that might help people to maintain some structure in their lives and to cope better with a really difficult situation. Here are some of the just practical kinds of advice that's been offered. This is from the CDC to communicate. Feel free to communicate with your workers, or if you're a worker, communicate with your supervisor about the stressors that you're facing. Try to stick with the things that you have the most control over. Try to develop consistent daily routines. Stay informed about COVID, but try not to let it drive you crazy. If if you watch it just constantly, it's a little too much. And keeping the spirit of everyone, that we're all dealing with the same stressor at the same time. And seek treatment as necessary for depression, substance use, and other things that can sometimes lead from stress. Next slide, please. So, what can employers do about this situation? One way to think about what an organization can do, how to respond and how to improve well-being for workers, is kind of along the lines of thinking in a public health perspective around primary prevention, secondary prevention, and tertiary prevention. So, primary prevention is we can kind of keep working on trying to find ways to reduce the stressors that workers are facing in this situation. A secondary one is to kind of find ways to help them promote well-being and cope with some of the problems and try to be resilient as problems emerge. And then a tertiary approach would be, providing them the services that they need if they have serious problems. Next slide, please. And I think I wanted to provide just a couple observations from employers I've talked to or workers I've talked to. And I think one of the most important ways to maintain worker well-being during this time is to really try to foster communication in many different ways. And you know, this is a little bit uncomfortable for a lot of large companies and organizations where we typically do things very well thought out and very well formulated and in a very standardized way across the workforce. But I think the kind of communication that's been necessary for organizations to be resilient in this pandemic has been to have a lot of sort of less formal communications. So you know, there have been many instances of town hall meetings and Q&A sessions with workers, open employee forums that are online sometimes, but just trying to show that you're constantly trying to answer questions, you're constantly trying to do better. And because this has been such an uncertain and rapidly changing condition, you need to have lots of provisional plans. So you may need to recognize that a lot of variables are unknown, that the organization's plans are still taking place, and for workers to know that that's the case. So it's a time when there's a little bit of discomfort with not having all the answers. You know, issuing formal policies and procedures is the normal thing that we do, but for COVID-19, this may be difficult. Because it's such an ever-changing situation. So, you know, we can't use the usual rule-making procedures that we use in human resources in this case, and we might have to allow mid-level managers more discretion and leeway to work on the fly, make some decisions to address worker concerns pretty quickly. And I think increased communication should be really encouraged at all levels. So, you know, a supervisor shouldn't just be saying to their workers, their working group, you know, call me if you need me or if you have any problems, but really doing more of a proactive effort to check in with people and look for signs and signals that maybe somebody's not coping well. And trying to build that extra bit of communication into normal workplace procedures. Next slide, please. So other ways we can try to build resiliency into organizations to deal with this crisis. I already mentioned that encouraging your managers to spend as much time talking about workforce mental health and physical health protections. You know, make sure that employees are getting education about COVID-19 as much as possible, and to acknowledge that it's a rapidly changing situation, and the company will be constantly trying to readapt to whatever comes up next. Focus on building trust within your workforce. So some employers have said that, you know, this has actually created an opportunity for them to understand a little bit more about who they are as an organization and how their cultural strengths are actually helping them through this crisis. And using employee engagement as a method to combat the crisis. So this is really a time to try to collaborate with workers as much as possible at the working group level and also at the senior management level to really understand what the issues are, and that the usual things that we use to assess worker well-being, like workers' compensation claims or EAP utilization and sickness absence, and some of the usual markers might not actually be the best or most accurate read of worker well-being under this situation. So surveying your workforce is very useful with specific questions about how people are coping with COVID-19. So in summary, it's also a good time to make sure that you have the benefit structure and mental health resources available to people who need it. This is certainly a situation that's affecting our most vulnerable workers in the worst way, and so we want to make sure we have a backup plan when things get tough. So this has certainly been a difficult time for all of us, but I think organizations can help to preserve the health and well-being of their workforce by inviting worker participation in decision-making as much as possible, by keeping issues of mental health and well-being on the radar screen at all times, and by trying to communicate in open forums and exchanges that show a genuine level of trust and concern at the management level. Is there another slide? Oh, now I'm going to transfer over to Dr. Chrisman.
Thanks, Bill. So welcome, everybody. I'm going to actually present, what I'm going to present is some results from a study that we actually sort of had in process, and then COVID hit. And what we did was incorporate some questions about COVID to see how it was actually impacting the workforce, and in particular tradespersons in Alberta and BC. Next slide, please. I'd just like to start with a brief land acknowledgement. I'm located on the traditional lands of the Fort William First Nation, signatory to the Robinson Superior Treaty of 1850. I do work a lot with Indigenous populations, and we just like to respect the lands that we are actually conducting our work on, so thank you for that. Next slide, please. So yeah, so as I said, we were doing a project, and a lot of what Bill has talked about, you're going to see some of results from actual workers sort of reiterate what Bill has actually already pointed out. But what we were trying to do is just to understand how organizational climate and culture influence the impact of bullying and harassment in the workplace, such that we could, if we could try to identify areas that we might be able to influence the culture and climate, it would maybe prevent a bully from actually being able to carry out their bullying role. And we were doing this in the trade sectors of British Columbia and Alberta, really focusing on the mental health and well-being of women. Our partner in this project is the Canadian Apprenticeship Forum, and it was the project was funded by WorkSafe BC. Next slide, please. So yeah, so as I said, we were really trying to understand what situations we could potentially manipulate in order to reduce the impact of bullies in the workplace on the mental health of these workers. As I said, the pandemic sort of began right in the middle of the data collection that we were conducting. So what we thought we might do is try to, we contacted our REB, put in an amendment to try to see if we could ask some questions about how COVID-19 was impacting participants in many ways, not just specific to the impacts of bullying, but just to overall, how is this affecting their job and their ability to conduct their job. Next slide, please. So what we did, we were doing a qualitative study, so we're using a grounded theory analysis, which basically just we're doing individual interviews, trying to ask people to answer specific questions to get an overview so we can identify some themes around that. And in terms of using the grounded theory, it really was that we didn't come to the table with any specific ideas. We were letting all of these ideas come out of what people were saying. Initially, our project was to actually be done by traveling to BC and Alberta, but because we saw the pandemic sort of coming, we switched that quickly to do Zoom interviews or by telephone just to avoid having to travel. The interviews roughly were 30 to 90 minutes in length. That really depended on how much information individuals had to share with us. So we saw some as quick as 30 minutes and others where people had lots to say, it took about an hour and a half. Next slide, please. So these were the questions that we asked specific to COVID. So we were asking about how participants were actually impacted by the pandemic itself. How did their employer react? If the participants were working, we wanted to find out things around how their role in the workplace actually changed. Were they provided with the necessary protective equipment or PPE that they needed? How are they able to safely distance themselves from other workers if they were able to do that? And we still wanted to find out a little bit more about bullying and harassment, because we wanted to see, did the pandemic in any way change their exposure to these potentially harmful activities? And then if they were not working, we wanted to understand how COVID-19 may have impacted their life in general. So we just wanted to find out how there was an overall impact. Next slide, please. So these were the participants. We had 27 people were interviewed overall, and you can see here the list of the different types of trades. So it varied quite a bit. We had automotive service technicians to HVAC, refrigeration, and industrial mechanics, but these were the people that reached out to us to participate. So we had a total of 13 men and 14 women, and we were trying to keep it, our goal was to establish sort of an equal number of males and females, even though the focus of the questions, a lot of them were around on females in the profession and the trades, because they tend to be the ones that were more harassed and bullied. So but we wanted the perspective of both men and women, so that's why we have about close to equal numbers there. Next slide, please. So what I'm going to do is just present some of the themes that came out, and this analysis was just recently completed, like last week. So basically, this is really hot off the press. But these were some of the things that we found in terms of themes coming out of here. We found that a lot of workers were just sent home. And in the trades, there were a lot of people that just their job there was no way that they could work from home, for example. So basically those who were able to work from home were those who were working more in administrative positions. And there's a few quotes here that just demonstrate what workers could and could not do. So some of them had the ability to have flex hours right now. So we don't have to work from set times when the office is open. We just have to basically allocate 8 hours daily or however long it takes. So they're just getting their work done. Others said we used to have weekly staff meetings, but due to COVID, we actually have a check-in every morning just to say hi and make sure that everyone's feeling okay. Because some of us are dealing with some tough stuff and have kids or 6 family members, it's been so supportive. So just demonstrating that even though some are still working at home, they're having check-ins that have changed a little bit from previous, just able to maintain everyone, make sure that everyone's healthy and have some sort of social support. And then a final quote, because of the nature of my class that I was teaching, I had a lot of hands-on component. It wasn't really easy to transfer it to an online class, so they decided to just cancel the class. But normally I would always have to teach class. Now that I'm at home, so just curriculum development and maintenance. So basically check in daily and respond to online meeting materials and emails, and I continue with developing exams and quizzes and learning materials. So still see some people still, their jobs have changed a little bit, but they're still able to actually maintain a position. Next slide, please. And as I said, some workers just don't have the option of working at home. So some people were laid off, like the first individual here, they just said, ultimately, I was laid off. This was primarily due to lack of available work, but also because I have young kids at home who are no longer in school or daycare. So they had other responsibilities as well, so sort of needed to be home as well. Another one said, still employed technically, but like you, I'm home with my kids and I obviously can't work from home. So trying to work when at home, when there's a bunch of kids and other responsibilities, it just makes it very, very challenging. Another respondent said, I'm no replacement for my son's teachers, and filling up every day with 2 young kids is not always easy. However, I have never been a particularly money-focused person, so the reduction in income is not a huge deal, though I would rather be earning it than having it handed out to pay taxes on later. It's an unprecedented time, and we are doing unprecedented things to cope. I think these social and financial sacrifices over the short term are not anything to worry about, and look forward to some semblance of normal in the not too distant future where we can return to work, school, and daycare. And then another really concerned worker who was unemployed said, we, the participant and his wife, are both worried that we will be homeless. So you can see how it varies. There's some people who are really, really concerned. They've lost their jobs. They don't know they're very uncomfortable because they don't know what the future holds, where others are like, well, it's an opportunity for me to spend some time at home and spend time with my kids. So it does very much vary how this is affecting individuals. Next slide, please. And we even had one participant who was not working but had an incredibly positive outlook. Basically, he said, a blessing in disguise, lots of time with the kids. Employment insurance is amazing. It's helped me get through. It's helping me budget more, obviously. I am working on self-development. I'm taking online courses during my free time to self-improve. So this individual is actually taking the opportunity that COVID has provided to actually upgrade themselves and work on themselves. So we didn't hear this a lot, but we did hear this definitely from one participant. Next slide, please. Some workers were deemed essential, and then they needed to remain on site, so they needed to remain working. So a couple quotes here, one from a supervisor and health and safety rep said, Dave, the employer, has changed our work schedule. Now we're working basically 2 on, 2 off of our shifts. So they split our crew up to try and keep one crew away from the other crews, sort of thing. And so it's a bit challenging for sure. We used to work just a day shift, and now they've split our shift because of COVID. So they've actually broken people up to try to maintain little pods that won't be exposed to each other as much. And we've seen that common in many workplaces. Another quote said, there is pressure to come in on your days off when things are down. And right now with the COVID, I think everybody's stressed out about going to work and getting sick and bringing it home. So even though these workers are still going, they're deemed essential, they are stressed out and they're worried about bringing the virus into their own homes. And then finally, the last quote on this slide says, the only way it impacts me is I'm getting less hours. Our job planners have to stay at home, so they don't really care. They're sitting at home getting paid, so I'm getting less work booked and scheduled. I guess my role is just to be a little bit more cautious is all. Less work, be more cautious when we are working, and follow more strict rules on certain things. So you can sense a little bit of animosity in this worker's quote, given that they feel there's people who are able to work at home, getting their full salary, doing fine, but if this particular person sounds like they're not getting as much work and they sort of need that work because they need the funding. So there's a lot of variation here as well, even with those who are working, whether they're working at home and able to continue sort of a regular salary versus those who are dependent on the hours. Next slide, please. And we did, again, to remind you that this was done shortly after the pandemic started and when we were collecting this data. And at this time, some tradespersons didn't have access to PPE. And a couple quotes here would indicate that. One said, face masks have been distributed infrequently. COVID and health-related information has been posted on doors and in the break room. Computer peripherals and machine touchscreens have been wrapped in stretch wrap. Workers showing any symptoms are told to self-quarantine for 2 weeks. Town hall meetings are now email announcements. Another one said that their workplace had no PPE mandates. So again, this may have been because it was early in the pandemic and these things weren't maybe deemed to be as important as they would be maybe now. Our toolbox morning talk were to keep everybody at a distance, and we didn't have medical masks, but we kept a distance, wore gloves, disinfected and everything. But then when the guys that were going to sites, then we were able to get them masks. But other than that, practice social distancing. So it sounded like in some cases, they had limited amounts of PPE, so it would be provided when it was absolutely needed. But other times they were basically instructed to try to practice social distancing as much as possible. And then the last one, actually, this respondent actually I think, made this comment after they shared this quote that, oh, maybe I shouldn't have said that, but the individual actually said, we're supposed to be wearing masks, but nobody really is. They keep a distance and they just talk. Some people do, but some people don't. We're pretty relaxed here. So you can see in some cases, even though PPE might be valuable and they have it provided, it takes a little bit of getting used to when you're not used to doing that in your job. I know even myself, if I go into a store, I pop out of the car and I'm like, oh, my mask, I forget it, I got to go back. So it's just the nature of getting used to doing that. And some people have found that more challenging than others. And in this case, some were not actually using it. Next slide, please. And physical distancing can be very difficult. So with this group of workers working with tradespeople here, sometimes it's really challenging to separate and be physically distanced. So they did give some examples where how they were trying to do this. So breaks and lunches have been staggered to reduce the amount of people in the break room at one time. So they'll have a specific room where they have for breaks, but they'll try to keep only certain numbers in there at any time. So they'll stagger either lunch breaks, and we've seen it in our own workplace, try to stagger entry and exit times so you make sure that people aren't colliding at the door. Another quote was, little to no physical distancing, can't troubleshoot machinery with operators 2 minutes away. So they needed to have the people, if they're trying to fix a machine, they need to often have the operator there to show them what's wrong or to be getting it to work while they're trying to fix it. So it can be really challenging when it's right there and it's not a 2 meter distance. So they said that's almost impossible, very challenging there. And then another one said, in the camp, we all have to stand 6 feet apart. Pieces of tape were put on the ground to mark it, just like in grocery stores. And when driving to and from site, the client demanded that only 2 persons in each work truck, and they have to sit kitty corner across from each other. So one is in the driver's seat and one is in the back passenger seat. And how did we react to that? Pretty annoyed, but understanding. We still do it because we don't want to get kicked off the site, I'm sure. But also because we want to make sure that we're all healthy and safe. At the end of the day, that's what matters. So this particular respondent was basically saying, we can do that. We do what we need to protect our health and safety and to make sure to ensure to others, especially those who are hiring us, that we are trying to be as respect health and safety as much as possible. But it can be difficult and challenging at many times because you're changing the way you've worked and you're not used to doing that. Next slide, please. So another one, a big one that Bill also pointed out in his presentation about the importance of communication. So being close to your work partners means communication and trust must be present. So in this case, a lot of our workers were responding to just trying to understand how much the coworker, the person they're working with, how are they abiding by the rules, and are they staying abiding by safe and health and safety instructions. So in the trades, the workers go to sites where social distancing just can't be happening. For example, if you're lifting 100-pound gear, you can't lift that by yourself. Someone has to be coming around to you to help you lift it. Obviously, at the time that they wear masks and stuff like that, but it's inevitable that you have to work beside the other guy. You just have to know the history of the other guy. So this guy says, I really need to understand, is he abiding by the rules? Is he taking care of not going out and partying with groups of people in the evening, for example? And another individual said, as a safety concern, for one thing, I have to ride with someone else in the vehicle. There has to be two of us. We all know cars and trucks aren't 6 feet wide, right? The person sitting next to me is next to me, and I have to trust that that person's being hygienic. But it's awkward to have a conversation around that with someone and say, hey man, are you being hygienic enough? So they were just indicating that some of these conversations are difficult to have. You want to know that the person you're working with, you can trust that they're taking all appropriate precautions, but it can be, on the other hand, very awkward to ask some of those questions, right? So communication is definitely key. Next slide, please. And we also started to see some growing animosity among workers. So I think this really revolves around the fact that some of them were being called back and others were not. So there was some perceived unfairness in that. So one person, for example, said, a lot of people don't get to work right now. We laid a lot of guys off, and there's people that are just more experienced than me, and I get to go to work. And that's kind of just luck of the draw, the whole situation. That's not very fair, maybe in their eyes. There's certain people that definitely the boss probably favors more than other people based on whatever reasons. I try to not really look into that. So this was from a particular apprentice, and basically saying I get the opportunity to work. Some other people who have more seniority may have been laid off, or so there a lot of animosity is growing because of that situation. Another individual said the client favors that person more, so that person's going to get sent out more because he's being requested. I think that does create a lot of animosity because there's a lot of guys that I work with that aren't necessarily the hardest working people in the world either. And it can be frustrating going out and working with them because you don't feel like these people are pulling their own weight or they're not trying. So another worker basically saying that I've got to work with somebody who's not probably the strongest worker, where there's some others that are laid off that probably are going to be better workers than this individual. So a lot of perceived unfairness in the situation. And then finally, everyone's been a little more stressed out with the whole COVID thing going on, reduced hours. There's animosity that certain people getting to go to work instead of others and that sort of thing, because at the end of the day, we basically all have to eat and pay our bills. So again, just more pointing out that that's challenging why some people get chosen and others don't. Next slide, please. So as I said, our project was really around bullying and harassment. So we wanted to also see what were the impacts that the COVID pandemic had on basically bullying. So we found that the theme sort of that those who get to work at home online, we see that the instances of bullying and harassment are lessened. And basically that's because they're separated now from their bully. So this was a journeyman that was in an executive role. He basically said, from my business perspective, if I went to a staff meeting before we went to a conference, it was always drinking or something after. That's just ripe for abuse. So we don't have that anymore. We meet, discuss the issues, go away and deal with the issues. We don't spend a bunch of time talking about the bar after, laughing about it, or telling somebody that they're stupid or whatever. None of that's going on anymore. I'm advocating for this to be the way we do business moving forward. So basically what he's saying is that they don't have the little social get-togethers now because obviously it's not appropriate. But that also prevents those from joking and teasing each other and potentially harming or bullying other individuals. So part of that social distancing has removed the opportunity for bullying. Next slide, please. And what we're seeing overall is there is a bit of an overall change in perspective. So the same journeyman that was in this executive role, he's the one who basically wanted to point out that COVID is really an opportunity to teach us as well that we're people and we're more than work. We're more than our house. I hope we learn through this that we're community in a country. We have to take care of each other. That's really what my message is nowadays. This is an opportunity for us to be different as Canadians. I think people need to realize that on a day-to-day basis, outside of COVID, these workers are those that their lives every day. So we can flip a light switch or we can flush a toilet. They're risking their lives every day, I should say. They're subjecting themselves to diseases every day. I don't think we've recognized the fact that they're working in a sick world right now, and they've always worked there. I think my organization is doing a shitty job of advocating for workers during this time. We're negotiating why there is some understanding of all these things you might think around getting more money, hazards and stuff, but we're not doing a good job of communicating that this is a pretty regular occurrence in construction and waste management and water delivery to be subject to some pretty sick stuff all the time. This is what workers do, and it's shining a light on that. So he's really saying this is an opportunity for us to actually see that the world is seeing what types of things these people are exposed to in the trades. So he's really wanting to point that out and saying that we really should start thinking of outside of the box and not just focusing on ourselves all the time, but let's be a community and a country and take care of each other. Next slide, please. So yeah, so I wanted to actually ask, so this individual was pointing out that there's not always, everything about this is not negative. So I just wanted to ask the audience, so in addition to all the challenges that we've faced and all the negative things that we've heard about COVID, have you found any opportunities or positive outcomes that have happened to you or to someone you know that have occurred due to COVID-19? So if you could just indicate if you have seen anything that's positive that's come out of this or not. Yeah, so this I think is very clear evidence that it's not all doom and gloom. A lot of people have seen different positive, and maybe during this discussion at the end we can shine light on some of some of these positive aspects are. But I do think there's a lot that we can learn from what we've been going through, and it's not all negative. So I think that's a good thing to take away from this as well. So just in closing, so to let you know that COVID-19 has created challenges, obviously, but it's also created opportunities. So for some tradespersons working in administrative roles, some of them are working from home with modified hours, and this may have reduced bullying and harassment because people aren't really working face-to-face anymore with their coworkers, so it's provided an opportunity for them to conduct their work and not feel threatened in their workplace. Some participants have lost their jobs while others have remained on the tools or continue to be working. In some cases, this has created animosity between workers. So COVID has created situations where bullying and harassment might be more likely to occur if these people reach out, if they're certain people who are feeling that they're being unfavored or reaching out and harassing others. There's the potential for that. We found that PPE at the time of the interviews was limited for some workers. That may have changed now. As I said, this data was collected near the beginning of the pandemic. And physical distancing at the time of the interviews was difficult for some workers. This potentially would not change much because they're still the same, their job hasn't changed that much. They still need to be able to fulfill the role. So it might be difficult for them to do that. And some trades courses are canceled. So for example, the people who are in the apprentice role who need to go and do their courses in order to get their red seal might have delays in trying to actually do that because they're not able to get into the courses right now because a lot of those have been canceled. And others, as we saw from the one individual, was really using the opportunity to self-improve. So there have been opportunities provided from COVID and not just all related to challenges. Next slide, please. So just in closing, I'd just like to acknowledge that this research was supported by WorkSafe BC. So we thank WorkSafe BC so much for the Innovation and Work Program for the funding. And this grant is in partnership with the Canadian Apprenticeship Foundation Forum. And I'd like to thank my research team, Robin O'Loughlin, Dana Corton, and Nadia Maker for their contributions in really conducting an analysis fairly quickly so we could be able to present this information to you today. So thank you so much, and I'm gonna pass the torch over to Doug. Thank you.
Thank you, Vicky. Yeah, I'm gonna finish up the presenting part of this with following up on some of the themes that have been mentioned by Bill and Vicky, but I really do want to leave some time at the end for some good discussion, and we can follow up on some of these great opportunities or learnings that you have had. Bill talked about one of the individual coping strategies is seeking treatment for depression or other physical or mental health problems. that in itself, I mean, we talk about treatment or healthcare provision a lot, but the pandemic has really thrown a wrench into that as well. It's not easy to just show up at your family doctor or your physical therapist or even a psychologist. They're, you know, the pandemic has influenced them as well. Sometimes they're closed, sometimes they have reduced hours, and you definitely now have to book in advance. So I'm going to talk about some of the research that we've been doing on healthcare and the transition from face-to-face traditional healthcare to remote services. And I want to start with a poll question and just ask those of you who are watching question about this. We could do the poll. Since the pandemic began, have you had an opportunity or had an appointment with a healthcare provider using telehealth or video conferencing? Go ahead and select one of those. Probably don't need 30 seconds for this one. That's a pretty quick question. Yeah, so 3/4 of you had. That's kind of what I expected. There's a follow-up question now. So those of you that did, how satisfied were you with the appointment? Select one of the following here. Loved it, I would definitely do that again. Pretty satisfied, neutral, pretty unsatisfied, or I hated it, I would never do that again. Okay, so that's this is interesting. Nobody hated it. That's great to see. And it looks like the majority either really loved it, they definitely do it again, or were pretty satisfied with some neutral or unsatisfied. This is almost exactly what we've been seeing from the patients in the study that we did. So if you go to the next slide, please. I'm going to talk about the transition to remote healthcare services by the healthcare providers funded by the Workers' Compensation Board of Alberta, WCB Alberta. So here's the timeline of COVID in Alberta. We had our first case March 5th. In a couple of weeks, very quickly, WCB suspended all in-person rehab services, all physical therapy, all multidisciplinary programs, occupational therapy was just completely suspended and stopped. Within 2 weeks after that, we were able to start training clinicians for remote services. And by April 3rd, the first remote work assessments were done using WebEx or Microsoft Teams, but video conferencing for these. And by April 5th, 1 month from our first COVID case, all physical therapy and work-related rehab programs transitioned to virtual care. Now, sometimes it was a simple telephone, but most of the time it was video conferencing. And this was a momentous shift. Vicky talked about these hands-on trades. Rehab, for the most part, is a hands-on trade, right? Not only from the clinicians, but also for the people undergoing rehab. And so this was a massive shift from in the clinic, exercise, functional restoration, retraining, to doing everything at home and through remote communication. If you go to the next slide, please. We were dependent on the technology available. Like I said, sometimes it was a simple telephone. Most of the time it was video conferencing. This is a picture of some more advanced virtual technology incorporating kinematic analysis. We're not here yet. This is, this is maybe 5 years into the future. We're not, the technology is not that great. We're relying on the same communication that we're doing here today. Next slide, please. From an exercise perspective, or from that rehabilitation perspective, the physical side was totally dependent on what people could do at home. So luckily there's a lot of resistance activity that you can do just using your own body. Some examples here. You go to the next slide. But really interestingly, the clinicians and a lot of these workers, the injured workers or claimants, were very resourceful in coming up with different activities that simulated their occupational tasks. These are 3 images of things that workers came up with on their own, right? Instead of lifting in a clinic, they used their laundry basket and did progressive graded activity with adding more and more weight to the laundry basket That was an occupational task that that person had to do at work. Another person had to do a lot of carrying at work, so they came up with a bag to carry their dog around. And another worker did a lot of pulling at work, and so they would load their children into a wheeled cart and go for walks. Really interesting, really resourceful. Next slide, please. So that's from the physical side. One of the things that allowed us in Alberta to transition so quickly was some of the research that we had done in the past around conversational rehab strategies. You know, psychotherapy is almost completely conversational based, but when you go to physical therapy or occupational therapy, there is this hands-on component. And so we've been investigating things like functional interviewing or motivational interviewing, things that, you know, more dialogue based or conversational based. And what we found is that these conversational strategies are as effective as physical strategies. Sometimes they work in synergy with the physical strategies, but for the most part, just doing a functional interview is as effective as a performance-based interview in terms of long-term return to work. The conversational strategies also have lower risk of pain exacerbation. We found that they do, at times, especially motivational interviewing, lead to more sustainable return to work up to a year later. And ideally, during the pandemic, these things are ideal for doing over the phone or over video conferencing. Next slide, please. So I showed you the timeline. We have kind of been tracking the number of work assessments as well as the number of rehab programs that have been done. And we just published a paper looking at the first 2 months of the pandemic, April and May 2020. This was basically about a month and a half. In that month and a half, we saw 1,223 remote work assessments, again, over the phone or video conferencing. We saw 249 completed remote rehab programs. During that time, we saw 0 adverse events. And this was really interesting, right? Like the big concern to a lot of physical therapists, if you're just watching someone do an exercise at home, are they gonna injure themselves? Are they gonna fall over? Whatever it may be. We saw 0 adverse physical events, and we saw 0 Zoom bombs. We were also really concerned about security, about people kind of jumping into the conversation, a very confidential healthcare interaction. But we didn't have any of that in Alberta within the first couple of months, and ever since we haven't had that. From a satisfaction perspective, we've tracked that, and typically we hit about 80 to 85% satisfied. But really interestingly, we've had a lot of informal comments about convenience, not only from the clinicians, but from the workers, right? No longer do they have to commute, no longer do they have to drive to the rehab center. They're able to do these things all, you know, the convenience of their home or on their couch. So high levels of satisfaction and a lot of convenience reported. Next slide, please. We've looked at the characteristics of the workers assessed. We don't have a lot of great data on outcomes, right? We're planning to follow these workers up for at least a year to see how the outcomes may have changed. We did not see a lot of differences in basic demographic characteristics like age. We didn't see a lot of differences in terms of clinical measures of pain, disability, quality of life. That was comparable in our comparison group, was the first 4 months of 2020. We did see a reduction in the number of workers coming in for rehab where English was their second language and interpreter was needed. And that, I guess, is to be expected, but also identifies a barrier to this kind of care. Really dramatically, and in terms of what we measured, the most dramatic differences were in terms of working status. Very quickly, even within the first couple of months of this pandemic in Alberta, we saw reductions in the number of workers coming in for work assessment or rehab who reported having a job to go back to, who reported being currently employed, and also who reported having modified work available. So this was, I think, kind of a side effect of these broader socioeconomic changes that were occurring that Vicky was talking about, with people being laid off, people being furloughed or terminated from their employment. Next slide, please. So that was interesting, and I looked this up. These are some statistics from Statistics Canada. I wanted to get a sense of how big this was in comparison to some of the last recessions. And Statistics Canada shows here that it's way bigger, right? This is we're seeing larger employment declines since February 2020 than during any of the last 3 notable recessions. And it kind of looks like from this graph that it's larger than any 3 combined even. So what we don't know is how this is going to impact the success of our rehabilitation, right? A lot of these people don't have that goal. They don't have an outcome to aim for, a job to go back to. And you know, obviously this is going to affect the return to work outcomes after rehab. Next slide, please. So, you know, we got a little bit of data, but it's also raised a lot of questions. And we did see this complete transition to remote healthcare services within a month of the pandemic starting. We don't know if it was effective. What we do know from some of the preliminary early randomized trials and systematic reviews that have looked at remote care even before the pandemic, it looks like both from a mental health perspective and a physical health perspective, remote care is as effective as in-person care. So really great news. What we don't know is this really widespread, you know, everybody's having remote care. We don't know the effectiveness of that. And there's probably some subpopulations where it works well, probably some where it doesn't work so great. We saw no adverse events observed and pretty high satisfaction. We don't know if that is typical of telehealth. I mean, obviously, a couple of you, looks like you had a bad experience. You would never want to do it again. Overall, it's looking good, but when might it go wrong? That's another question we have. Are there urban-rural differences? That's really important, right? If you're living in a small town in a rural part of Canada without good, reliable, high-speed internet, how are you going to do a video conference, right? Like some of these places, they don't even really have reliable cell phone coverage, let alone high-speed internet. So are there differences in terms of technology or the outcomes from remote healthcare services in these settings? And lastly, like I mentioned, we're already seeing major declines in employment status, likely due to these broader socio-economic changes. How is that impacting people's health? How is that impacting outcomes from rehab or treatment? We don't know that. We need to follow these people up for a longer period of time. Next slide, please. So just to summarize everything, Bill talked about, you know, the magnitude of this pandemic, talked about stress levels being so high, a lot of anxiety, a lot of depression, both at home and at work. It's truly an unprecedented and difficult event that we're all living through. Yet we have seen a lot of really great examples of resourcefulness and resilience, many examples of personal and organizational resilience. We're seeing technological solutions that are helping, both from PPE, clinical solutions, right, remote healthcare, and so on. Couple of recommendations that we would have for all of you is that you really do, in addition to the PPE and the physical health, we need to be aware of all of our you know, our own, but also our worker mental well-being. And that needs to be factored into all decision making. When you're rolling out a new policy, think about how that's going to be affecting mental well-being. And lastly, we've kind of touched on this in different places through the presentations, but we do need to direct more attention to the most vulnerable, those that don't have, you know, the funds to purchase the high-speed internet, those in rural Alberta, older workers who are, you know, very much at risk of serious consequences from COVID virus. So we just kind of encourage you to think about the most vulnerable who are working in your organizations and your companies, and think about how you can go to your way to direct more attention and meet their needs. So that is everything that we had prepared. We want to open it up for discussion and questions, and hopefully we'll hear some of the positive experiences that you've had.
Thank you so much, Bill, Vicky, and Doug for this extremely informative presentation. Immediately, we'll start with the Q&A session. So to our audience, if you haven't already, please insert your questions in the question box. Our first question is about the statistics you presented, Bill, at the beginning of the presentation. And the question is, how do the percentages of people reporting mental health post-COVID compared to pre-COVID?
I think there's a lot of surveys that can be found online now. Some are like employer surveys, some are workforce surveys, some are population surveys. But I think we're about twice as bad as what we would normally be. So whereas the rates of people reporting nervousness, anxiety, and stress would typically be around 25 to 30% of a working population of adults, we're more like 50 to 60% in some cases. So I think I think it's taken a little time for this to develop, but I think it's beginning to really take its toll on people. And I think while they were able to cope with a few months of isolation and other problems, it's a year is really testing people. And I think we're seeing as time goes on that the statistics are getting worse.
And that answers my next question, and that was if those numbers declined as people adapted to the situation, but they keep rising, as you just mentioned. Thank you for answering this question. Our next question is, so I am an occupational therapist, and for my clients who do not have jobs to return to, I have found it to be very challenging to assist people in finding new employment. I was wondering if there was any research on this.
That's a tough one, and the research, I would say, is probably not that great. We know that not having a job to return to is one of the most potent negative prognostic factors from rehab in general. People that don't have jobs to go back to are unlikely to have a successful return to work outcome following rehab. I would say that from the clinical experience and the clinicians that I talk to, when there is no end goal like that, it affects motivation. It affects a lot of things during the clinical interaction. What the clinicians tend to try to do is move away from the job and towards activity. What are some of the meaningful activities that you want to do at home? Do you want to spend more time with your grandkids, with your own kids, their hobbies or other things like that you have a little bit more control over, and build that into the rehabilitation program? As an occupational therapist, I'm sure you're an expert at that, but it's just finding something else besides work that is meaningful while the worker continues that job search. I think there's other things like supported job searching or other things that the Workers' Compensation Board or private insurance agencies can assist with.
I can add that working from home for those who are have a disability or are on sick leave has been an interesting situation if you're an occupational therapist, because in some ways working from home offers people who might have difficulty in the workplace to actually have more flexibility and be able to flex their schedule in ways that they couldn't if they were at the workplace. So for those who are able to resume a job working from home, it actually provides kind of a job modification that may not have been there before. But we also have, at least in the organization I work in, you've seen a lot of examples of people having a lot of ergonomic problems working from home as well. So it's a kind of a mixed bag of problems. If you're dramatically changing where and how you work, that it also, and people just do not tend to have the workstation setups at home that they have in the workplace, and I think a lot of complaints about sore necks on Zoom calls and all sorts of things like that. So I think from an occupational therapy standpoint, there's been kind of pluses and minuses of people trying to adapt to health problems or injuries post-COVID.
Yeah, and Well, I'll just add too, from what we saw from especially one of our participants, the opportunity that they can use COVID as an opportunity to upgrade and to do further training. We have seen that people have used this opportunity to actually do some of that. So trying to find a job after, if that area is not really something that might have a lot of positions to go back to, that there is the opportunity to do a little bit of upgrading and training to position yourself better for a job.
Thank you so much. Building on that, will you be looking at the long-term sustainability of the outcomes during treatment that was done virtually, or a combination of virtual and in-person treatment? If so, what are you expecting to see in those results?
We're definitely planning on this. It's early days yet, and we don't really have a sense of even that early return to work, other than it really looks like, you know, the job market has been hammered, and I'm suspecting that the outcomes are not going to be good, you know, depending on the comparison group. If we go back a year, just like Bill says with mental health, I'm suspecting that the return to work success rates are going to be much lower this year compared to last year or pre-pandemic. Although, you know, I do want to emphasize that work is kind of something that we don't have a lot of control over. And when it comes to the health outcomes, whether it be pain, whether it be reported disability, or even health-related quality of life, the trials that have been done on remote care, the randomized controlled trials and other experiments that have been done, are showing that it looks like it's just as effective. It doesn't matter if you go to a psychologist in person or talk to a psychologist over the phone or a video conference, you're going to have the same impact on your levels of anxiety or depression. If you're seeing a physical therapist over the phone or through video conferencing, your long-term outcomes for that sore shoulder are probably going to be the same at 2 to 6 months as if you went to that physical therapy in person. There was one trial, actually, I was just reading it yesterday, looking at a telephone advice line in the UK. That's another thing that we've started here in Alberta, a rehabilitation advice line where people can just phone in. Alberta Health Services started it up. And there was an RCT in the UK looking at a physiotherapy advice line. And they found that outcomes were exactly the same at 6 months in both the in-person comparison group and the phoning a telephone advice line, except for satisfaction. The advice line had slightly lower satisfaction than the in-person care at 6 months. But it wasn't great. It wasn't nothing to write home about.
Thank you, Doug. Bill, you described at the beginning of the presentation, you mentioned that employers should pay attention to signs their employees can demonstrate. Can you describe some of the signs that can inform an employer that an employee is not doing well or needs further support?
Great question. I think probably if you're a supervisor and you have a working group, then you know what you're really doing is, from your knowledge of having worked with people for a long time, try to look for signs that somebody's not either their productivity has dropped, or you don't see them on meetings. You kind of lose touch with them in some way. Those would be the things to watch for, and certainly just checking in with them as regularly as possible about how things are going at home and how things are going with their work is a reasonable thing to do. I think at the higher levels of management, this is a bit more difficult, and I think probably something that could be very informative is to conduct a well-being survey of some kind. But the other place that you're most likely to see it is in your health. If in the U.S., most large employers have a private health insurer, so they can ask for information about utilization of services, and that's another way to kind of to watch for a signal that there's a real uptick in mental health services and employee assistance programs and things like that. So I think I'd watch for utilization rates pretty closely. I think some of the things that we'd normally look at are like sick days and things like that aren't really going to be very telling in this case.
Thank you, Bill. And then multiple part question is, what advice do you have for Canadian employees who do not provide mental health resources? So it is expensive, so why should they? What is the return on investment? And keeping in mind our universal healthcare is supposed to provide the basics.
Who wants to
I'm
take
looking
that?
I'm looking at the Canadians.
That's that one was for Bill, but I invite anyone who has some insight to jump in.
So the question is, if what are the other services that are available apart from going to see a psychologist or something like that? I think that, you know, there are more and more online resources for people around COVID-19 and coping, and like I think that's just sort of cropped up in the last few months. But I think, you know, trying to think about wellness and exercise and things that are really difficult to do if you can't go to the gym and you can't reach out to the people that you normally do. I'd look at some of the helpful information that's online if you don't have access to formal systems, because I think there's actually some good useful information there. I don't know if I'm answering the question very well, but does anybody else have any thoughts?
Yeah, I can make some comments, Bill. So I know in Ontario, the provincial government has actually supported a program called Mind Beacon, that they've made that open to everyone, so that there are mental health resources that are available online. And I know the federal government has made some resources available too. I've heard varying things about the quality of those resources. In some cases, the people found them really helpful, and others not so much. I know for people who are working at home and they've got kids and they're stressed out because there's so much demand on their time to sit and do an online thing where you have to fill in all these questionnaires, it's not that feasible. So that can be a challenge. But Ontario government is trying to support, I know within Ontario anyway, many mental health resources that people can access free of charge.
Thank you so
Yeah,
much.
I agree. I was just to say that it is a big issue though, right? Like here in Alberta, psychotherapy is really not funded all that well. You have a musculoskeletal pain condition, it's way easier to get in for an operation than it is to receive that frontline psychotherapy care that can help you cope with your pain or the pain management skills. So I do think that there's more that can be done to get access to these effective psychotherapy and other mental health services within the regular services that are offered to Canadians.
Thank you very much. And then another question. So you mentioned, Doug, that there was zero Zoom bump, but for those receiving telehealth or virtual services, have you found difficulties related to not having privacy or having space in the house?
Yeah, it's an issue. We have not, and there were actually no formal complaints made about lack of privacy or anything like that. I would think that if a complaint would be made, it would be towards a healthcare provider, that the healthcare provider is working in a non-confidential situation. In talking to the therapists that I work with closely, they're instructed to really make sure that you have a private room. There's policies around confidentiality. There's policies around using a headset. So I think that the clinicians are going out of their way to make it as private as possible. And yeah, like I said, we didn't see any formal complaints.
Thank you so much. And then, so it's important to build trust between employers and employee during this context. So what can employers do to initiate this or build that trust?
I think the thing that I think is most important is to kind of convey to your workforce that you're trying as hard as you can, but that this is a difficult situation and that you might not have all the answers, and kind of to be a little more less polished than usual. So and to show that you really want the participation of workers to solve problems. I think that's important at leadership levels, but also important at supervisory levels too. So you know, rely on workers. They know their work better than anyone else, and rely on them to tell you, you know, what's difficult, what sorts of PPE problems are there, how is it difficult to do your job and sit in a truck next to somebody while you're trying to be distancing and things like that, and try to involve them in processes. So I think that it's a time when, you know, bottom-up approaches are really useful.
Yeah, I would agree with exactly what Bill said. I think it's building trust during this time is really difficult too, because a lot of our conversations, and we're not able to make that one-on-one face-to-face connection with people. So having that trust built in the first place before the pandemic started would really help in terms of allowing people to have these conversations that are definitely needed. I know even my own research team, I've had many conversations with people, but we've sort of had that trust built. With the newer people who've come on since the pandemic, it's difficult, and my approach is just to always ask and tell people it's okay if you're not as productive as normal. That's okay. This is just to let them know that you're understanding and you understand the situation. I think that can help to build trust, if they know that you actually care about them, and it's not just about what you can produce for them. It's really about, I care about you, and then I want to make sure that your health is number one, and we can move forward from there.
Absolutely. And Vicky, you mentioned something about communication. So with flexible hours, how can a team collaborate effectively with different hours for each employee?
Yeah, so definitely a challenge. So with flexible hours, I think part of it is that the way flexible hours often are being used over the pandemic is just to ensure that there's reasonable numbers that don't come in contact with other numbers. So basically, you're going to be able to communicate well with those that you're seeing, and it might be a little bit more challenging with others that you're not seeing. So the flexible hours are often used for that purpose, to keep people separated. So you just need to make sure that people do have somebody that they can outlet to, that there's someone for them to talk to or contact, or even have to make sure that they can reach out to the supervisor, whoever it is who's setting up these hours, is to make sure that this is going to work for you. So again, it's really about open communication and letting people know that this is going to be challenging for me. I can't do this flexible hour thing. Is there a way that you and I can work this out differently? And I think that's the main thing, is to be flexible during this, and just to show again to employees that your health is my main concern, and we're doing this to try to preserve your health. We still have some things to get done, but the number one key is to make sure that you're healthy. I hope I addressed that question.
Absolutely. To your knowledge, what are the requirements for an employer or workplace in terms of providing PPE?
That varies. I think occupational health and safety is provincial, and in Canada it's a provincial legislation. So in Ontario, we do have the Occupational Health and Safety Act actually does have a provision that is the employer who should be providing that. That said, I've seen varying things happen with that, and even in my own employer, I was responsible for my research institute to make sure that they were provided with the appropriate PPE. It wasn't necessarily the greater employer, it was a subset. So it does vary, but it is the role of the employer to make sure that the appropriate PPE is provided to ensure that a worker can feel safe when they do their job. In Ontario, workers can say this is unsafe, and they can refuse unsafe work if they feel that anytime they are at a greater exposure, they are able to refuse unsafe work until the appropriate PPE is provided.
Thank you so much. And then are there any measures for people who have to be close to each other to do their jobs? For example, that example that you mentioned, lifting 100 pounds must be with another person. So are there any measures or procedures for this kind of work?
Not that I'm aware of, other than making sure that you're wearing protective equipment. So if the mask would be a big one if you're going to be within 2 meters of people, and it is understood in most workplaces that there's going to be a situation in some place where you are within 2 meters of someone, just to make sure that you are wearing the mask. In some cases, face shields are appropriate too. So it depends on the nature of the work, but just to make sure that other precautions are taken when there's no way you can avoid being within the 2 meters of someone, to make sure that other safety precautions are taken. Beyond that, there's not a lot that we have in place right now.
Thank you so much. And I think this is for all of you. So what do you think will be the legacy for organizational health when COVID-19 is over?
Well, one easy one is that we'll probably have a lot more people working from home, and working more independently, and not, so maybe that will really change the nature of the relationship that workers have with their employers, and it could be could be good or bad, or good for some and not good for others. But I think that kind of maybe an employer, and what's interesting about it sort of goes back to cottage industries in the 19th century, where people were making shoes in their living rooms and things. So like maybe we're kind of going backwards in time to a different day when people did their factory work at home. So I think that will certainly be something that I can't imagine it going back to exactly the way it was before.
Thank you so much. And then what are your
Actually,
thoughts?
can I, before you go to the next one, could I comment on that?
Definitely, go for it.
Because I do think that this is going to have, the pandemic is going to have, I think, long-lasting and permanent changes on the delivery of healthcare. Right, this traditional mode of in-person, going to the doctor, going to the therapist, going to the psychologist, I don't think that's going to exist. I think that there's going to be permanent changes and more flexibility. And it's really, really exciting to see this in terms of some of these populations with unmet needs in terms of access to care, rural Canadians, people that don't have a psychologist in their town. I think that the communication technologies and remote healthcare services is really opening up so many opportunities that will be able to provide care to the people that need it.
I'll just make one last comment before you jump to the next question too. I think, as Bill said, it seems almost like we might be going back a little bit in time, but I also think that the pandemic has actually sped up things moving forward. That I think our economies were slowly turning towards more we were getting people that are getting rid of the office and having shared office environments. Now that we've sort of moved it from shared office right into the home, but I do think it sort of sped things up as well as moving forward into the future, and definitely the acceleration of AI and opportunities that we can be doing things from a distance, all the new technologies. I do think it sort of has sped us up a bit. And I think we were headed that way anyway, but it's just been accelerated by the presence of COVID.
That's very true. Thank you, Vicky. And we're just going to wrap up with our last question. So what are your thoughts on how the duty to accommodate legislation for people with disabilities will be impacted from COVID?
I know that in the U.S. we have Americans with Disabilities Act, and I think some of the I think what may be changing is the way that we view what a workplace is, and what represents a reasonable accommodation. And I think this is being tested with people working from home and having problems with their equipment at home, or having difficulty being comfortable, and to what extent is an employer responsible for making a workplace safe and comfortable at home. I think will be something that will probably transition a little bit over time.
And if you have, yeah, would you like to add anything?
But that's not really a change in legislation, but I think it's maybe a change in the way that the legislation is interpreted and applied.
Absolutely. And if you have no addition, then we can go ahead and end the webinar for today. Thank you so much, Bill, Vicky, and Doug, for describing those challenges and disruptions in the workplace related to COVID. And to our audience, thank you so much for your participation and continued support. Don't forget to visit our website at workwellnessinstitute.org. All of our live webinars are accessible to the public. Thank you so much for your participation. Stay safe and take care of yourselves. Thank you so much again, Bill, Vicky, and Doug, for your experience. Have a wonderful day. Bye-bye.
Thank you. Bye.